With regard to the cloud, unfortunately, 10% of the agencies have adopted cloud in the federal government. So it hasn't really been a success on the federal level, unfortunately. But in the private sector has rapidly adopted cloud-based solutions. And I know Representative Matsui actually touched upon this, but I have a couple questions. What are some of the barriers to the adoption and expanded use of cloud-based computing and cloud-based storage in the medical space, and how can we facilitate the expanded use of cloud? What are some of the laws that need to be examined because of the way they interact with the cloud computing? And anyone in the panel can respond. Doctor?
Cloud expert should start, probably.
Well, thank you, Mr. Bilirakis. I appreciate that. So, in our experience with Amazon Web Services, the take rate isn't as great as we'd like it to be with government agencies, but it is changing. And as I mentioned in my testimony, we already serve many around the world. But in the federal government, there are areas where Congress could lead by example, either through legislation or working in their oversight role over agencies to ensure that agencies do use cloud when it makes sense to. Right now, sometimes agencies feel constrained to buy only traditional hardware and software and pay their own in-house people to run it. And that it turns out to be highly inefficient. And so hopefully Congress, through the two acts that I mentioned in my testimony, could, including FITARA, could encourage the government use of cloud to the benefit of our taxpayers, of course. Thank you.
Anyone else on the panel? Okay, I'll get on to the next question. With regard to the medical devices in the dialysis world, they've remained largely unchanged. You'll agree with that. If you were to need kidney dialysis, you'd basically be using the same device that your parents were using. There's not been any large innovations in that space. However, in the world of consumer electronics, there have been continued innovations in this space. Television today, televisions are radically different from televisions in the 1990s. Cell phones today are different than they were the ones in the 1990s. Tablet PCs are different than the laptops and notebooks from the past decade. So my question is, how is it that we can have rapid innovation in consumer electronics with lower costs for consumers, but slower innovation with higher costs in the medical space? Is it the cost of the excessive regulation? Is it the higher barrier to entry? How do we encourage shaking up the status quo? And whoever would like to begin, please.
I actually will take it only because I'm aware of a pilot project that is actually part of the Center for Medicare and Medicaid Innovation Challenge Grants, which is being conducted at the George Washington University Hospital in consult with a company named Delir and a company named Baxter. And a number of other partners, and it deals with kidney dialysis in one way or another. So I believe that community is definitely listening. They're really looking into things like remote patient monitoring, et cetera. But if I step back for a moment, I think one of the largest barriers to adoption for this entire field are the outdated rules that we have governing reimbursement for services. Particularly when we talk about remote patient monitoring, it automatically gets lumped into something called telehealth reimbursement, and it's not necessarily the same thing. Under the telehealth rules, you have to start off from an originating site of care that CMS stipulates. It has to be a specific disease condition. There's only about 20 or 25 of them. It can't happen in a metropolitan statistical area. It has to happen in a health shortage area. It has to be live voice and video, which removes automatically all the stuff that we're working on. It's incredibly restrictive. So according to the American Telemedicine Association, doctors are only able to access between 5 and 8 million with an M worth of reimbursements for telehealth consults. You know, the CMS budget is near $800 billion. So I would pause to think that some of that could be targeted towards incentivizing the uses of these types of equipments and services. Because the issue is this: if I'm a hospital or I'm a health plan, If I'm not being reimbursed by my largest population, which happens to be Medicare, I'm not going to be incentivized to adopt those technologies, and I'm not being paid to use or provide services, and I'm not going to be paid to provide. So I think that's a real huge barrier to adoption. And then that folds into, of course, the incentive payment program, which has done a good job of incentivizing the use of electronic health records, but there's no aspect that actually allows for patient-generated health data to go into that electronic health record. So the patient is really literally cut out, except when he walks into the facility. And then you've got the situation that your colleague was mentioning where we have a scribe, typing stuff in while the doctor and the patient discuss their care. So it's a real complex issue, but I think that those are barriers to adoption.
Thank you very much. Thank you, gentlemen, for your testimony. I yield back, Mr. Chairman.